I'll tell you, if you choose ArtLab to get your teeth done, you'll have chosen the best place to have the work done. I did a lot of research. I visited a lot of places. I talked to a lot of doctors before I came here. This was the first place where I felt like they cared more about me, cared more about what I was going to go through than just a number or what came out of my wallet. They were very, very personal, from the staff to Dr. Rashad. They showed nothing but care for me and what I was going to go through. They talked me through every step. I never felt so comfortable my entire life. Dr. Rashad has definitely changed my life. I have a beautiful smile now. I no longer smoke. It made me quit, something that I've been doing for a lot of years. His staff is personal as well as he is. They make you feel at home, really comfortable. I had all kinds of fears until I came here. I had none. They spoke honestly with me. They told me what was going to happen from step one to the very end. And here I am at the very end with a smile that I love. And I couldn't be happier. If you choose ArtLab, you will have chosen the right place to get your work done.
Here is another ArtLab Dentistry patient who presented with severe tooth wear and bite collapse. What's obvious is that his teeth are now less than half the normal size, and his gums have overgrown to compensate for the tooth wear. When we look in his mouth, the teeth are obviously significantly reduced in size, and the gums have grown down, and the bite has completely collapsed, not allowing new teeth to be fitted. From the sides, it's even more obvious. And when we look from the top views or the occlusal views, we're worn down into the softer part of the tooth, the dentine, which means that teeth can wear rapidly once we are in this phase of pathology or disease. So we need to intervene really quickly before Stephen loses all of his teeth. So we put Stephen into temporaries by opening up his bite, but his gummy smile is still there. So that's the next step. We make some designs, make surgical guides that help us push the gums up in exactly the right place for ideal final restorations. And here he is with his final restorations, final provisional restorations, which have ideal tooth heights. After his approval, we proceed and fit his final ceramic restorations, which have ideal shape and contour, and we've opened up his bite into ideal positions. Look at him before and after, improving his bite, space, tooth heights, and actually breathing. From the top or occlusal views, the wear has all been cured, and we've got very nice, strong, stable biting surfaces, and the bite collapse has been restored. We follow up our patients regularly. Everyone comes and see us, and this patient was followed up at 4 years and he looks great. But we have many more patients that have been followed up 10, 15, and 20 years with similar treatment, and they're all holding up pretty nicely. And here's Stephen at the end of his treatment, looking youthful. We've corrected his bite issues, his gummy smile, but what is really important is that his appearance is so much better as a whole, and he's just a more vibrant and lovely person after the treatment. And we're grateful for having him as a patient.
I'm Eric Roberts. Your relationship with your dental experts and with your teeth can be more complicated than your relationship with your family. And speaking of family, ArtLab Dentistry has become family to us. And when I say us, I mean my family. Dr. Rashad has taken all the anxiety out of this area of our lives. He is a true artist, a true solver of problems. I can't say enough about this kind of miraculous experience, and that's why I couldn't wait to share it with you. Dr. Rashad is the man. Eric Roberts here.
Michael Hahn, took this course with Dr. Mamali. It's my first cross course. I had some high expectations, and all those high expectations were met. I hate cross, just to be honest. I love surgery, but I knew that cross was a very important component to my practice and something that I needed to learn. Dr. Mamali's course was very thorough, very hands-on, and very available to answer all my questions and to help me think more as a prosthodontist and to plan my surgeries with, obviously prosthodontics in mind first. So thank you.
This is a perfect example of a patient who's been to multiple doctors and has been told that he needs an all-on-4. That means that this patient was told that he will need to have his teeth removed, his gum cut away, and his bone shaved down so he can get a standardized prosthesis put in place of his teeth. He's a young man and he doesn't want to do that. Is there an alternative? Well, there is. With the advanced grafting techniques that we have at ArtLab Dentistry, we managed to preserve his own natural gum structure and bone structure. We were able to rebuild the gums in such a way that they will remain in the same place. They wouldn't shrink. And we created this natural gum shape with the help of some temporaries, molded it, and very quickly this patient received his upper implants. The only difference with his upper implants and an all-on-4 is that the teeth are coming out of the gums, his own gums, with a nice natural look, and maintain the integrity of his smile, his gums, and the feel that those teeth have at the end of the treatment. This is the ArtLab difference.
Hi, my name is Jennifer. I received the full set of implants in 2018, so it's been almost 8 years. And they look and feel great. I have no complaints at all. In fact, I get a lot of compliments. You look amazing. Oh, thank you. I really don't know what else to say other than this place has gone above and beyond, and I can't imagine having received service like this anywhere. And he's cool. Off the vape that I'm crying. Sorry. The teeth go all the way back. And no other dentist could do that. Only 4 in the front on top for the body. Yeah, and now if I smile, you're no gown. Thank you so much.
We would like to introduce you to Dr. Rashad's remarkable contributions to dentistry. Today we'll explore his pioneering work in aesthetics and implant dentistry. Dr. Rashad's impact began nearly 2 decades ago with groundbreaking publications in the Journal of Prosthetic Dentistry. His early work introduced a revolutionary technique for implant reconstructions, setting the foundation for what is now known as CAD/CAM dentistry worldwide. Credited as the innovator of the combination prosthesis on implants, Dr. Rashad's innovation marked a significant milestone in implant dentistry. His technique has been adopted globally by leading implant specialists and continues to evolve with advancements in technology. The Journal of California Dental Association has featured Dr. Rashad's concepts on managing the collapsed dentition for full mouth reconstructions. This seminal article has been widely referenced in implant textbooks, emphasizing his expertise in comprehensive dental care. Dr. Rashad's approach uniquely balances function and aesthetics, as evidenced by his collaborations with leading figures in dental aesthetics. His publication highlights innovations that enhance both the appearance and functionality of dental restorations. For years, Dr. Rashad has been sought-after lecturer on implant and aesthetic dentistry. His insights into rebuilding failing dentitions have shaped international best practices and inspired dental professionals worldwide. Dr. Rashad's contributions extend to minimally invasive dentistry and biomimetics, feature prominently in international, peer-reviewed journals. His work, including chapters in renowned textbooks like QDT and Fonseca, continues to influence dental education globally. Dr. Rashad's dedication to advancing dentistry through innovation and education remains unparalleled. His ongoing commitment to excellence ensures that patients receive the highest quality care available today.